Welcome back to Celebrate Michigan. We are talking with Dr. Kosinski, who is reaching out to laid-off workers and others impacted by the recession by offering high-quality dental implant and bone grafting procedures for at least 50% off the regular prices. Tell us a little bit about that. That's incredible.
Well, you know what? We have a lot of problems here in Michigan, and some of us are very blessed, and we're trying to give back to the community a little bit. And I was fortunate a while back to meet a friend in California, Dr. Todd Engel, who developed a teaching program called the Ladera Ranch Implant Institute. And he asked me to become involved and organize a program here in Michigan. And what it is, it's a teaching program where we teach other general dentists, licensed dentists, to do what I do, implant dentistry. You should probably ask me what an implant is. A dental implant is a piece of metal that's made of titanium, and it's surgically embedded in the jawbone, and it simulates the root of a tooth. So it's used for people that are missing teeth, or all their teeth. And we can actually anchor a tooth on top of that implant. But it's a very expensive procedure, and for those people who are selected into our teaching program, we're doing it at a fraction of the cost. So the public is very appreciative of what we're able to do.
So this is the sort of thing that would normally be out of reach because of those costs.
Well, yeah, a dental implant, could range in the $4,000 range, and we're able to do it for $699.
Wow.
So it's an incredible savings for those people that are candidates.
Mm-hmm. And this is a better thing for people than dentures, which are, you take out and they're removable. This is like a real tooth in your mouth.
Matt, if you were missing your tooth, if you lost a tooth because of trauma or a hockey accident, or Krista popped you one for saying the wrong thing, stepping over her lines.
Who knows?
I think you'd rather have something permanent in your mouth. And what we're able to do for the public today, very precisely and with a high degree of success, is give you back your tooth so that it looks amazing, feels amazing, and get your life back.
Now, I believe we have some B-roll on this topic, so let's take a look at that.
So what we have here is one of our programs. It's done in the office. It's a 3-day program, and we're actually teaching general dentists with a wide variety of experiences how to physically place a dental implant. They get some extensive training. They get to work on models, but then they actually get to place an implant in one of my patients, and that's where we're reaching out to the community. So the community is doing us a favor too. It's not experimental. It's all high quality product. We don't send anything overseas. It's all done right here in Michigan. And it's just a wonderful experience for our patients. We get lots of hugs in our office following these procedures, not only because of the cost savings, because we're really improving the quality of life of people that are missing a tooth. If you can only imagine being without teeth, being without back teeth, must be a horrible experience. Mm-hmm. And being able to actually put teeth in people's mouth is just a wonderful, wonderful thing to do.
Absolutely.
Now when kids lose teeth though, like they've already gotten their adult teeth, is this something that you would do for them as well?
No, it's not for children, it's for adult teeth. And people lose their teeth for a number of reasons, neglect or trauma, gum disease. There's a lot of things. Our older population, it was pretty routine in the past to have teeth extracted. It's not the case anymore. We're trying to save teeth. We talked about the laser. We're talking about brushing and flossing earlier. The public understands how important it is to maintain your teeth, and better than ever before.
Terrific. So now those people we saw who were in your class and were able to do a procedure on a patient, those are all trained doctors who want to expand what they're able to do. Exactly.
Because dental implants is something that, although it's not new, it's become very popular. Mm-hmm. You're reading it in magazines, you're seeing it on TV. So the public is asking their dentist. And the dentist wants to provide the service. You love your dentist, you love your dentist, you want to stay with your dentist.
Sure.
And so that dentist needs some extra training, and we're reaching out to them to give them that extra training.
So when they finally get that implant, is it just like a tooth? Can you even tell the difference?
You cannot tell the difference. It looks and feels like a tooth.
Awesome.
It's amazing. It's just amazing technology.
What's the difference between this and veneers?
Okay, a veneer is where you have a discolored or malpositioned tooth, and what we do is we reshape a part of the tooth ever so slightly, and we bond or we adhere this little piece of porcelain. It's like a lady's fingernail. And we actually bond it to the tooth so it's permanent, and it's an aesthetic improvement over what they may normally have.
Okay, versus the implant, which is basically
if you're missing a tooth. If you're missing a tooth.
Okay, so Got it.
So if you have someone come in for an implant and they want their teeth back, how do you figure out how to shape those teeth to that particular person's mouth?
Great question, Matt. What we do, it's we numb the area. We don't even numb the whole jaw anymore. Just the tooth that we're working on.
Yeah.
We have we remove a little bit of tissue. We don't even use a scalpel anymore. Okay. Bone is not innervated. There's no pain receptors in bone, so this procedure does not hurt at all. You're a little sore, but it doesn't hurt. We have a series of drills. We make an opening in the bone, and all our implants today are basically threaded in. They're allowed to heal for a certain amount of time. We put a tooth on.
Fascinating.
Wow.
Very advanced stuff. Well, we're going to take another quick short break here. When we come back, we'll talk more with Dr. Kosinski, and we're going to speak with a patient who has undergone one of these dental implants.
Stay tuned. We'll be right back.
Ready? Go get it.
Oh, come on, Randy. Animal shelter, here I come. And no, I'm not crazy or emotionally damaged. That's a stereotype. I just belong to a total loser. I'm a good dog. So if you want a pet, adopt. And if you see Randy, tell him he dropped his wallet.
So my uncle calls and he says he's dizzy and he's losing his balance. I'm like, Unc, you want me to take you to a doctor? He's like, no, I'm gonna look up the symptoms. I said, your symptoms are you're dizzy and you're losing your balance. So he said, I can't get on the internet because my arm is numb. I said, well, use your good arm and dial 911. Stroke's no joke. If you or someone you love is showing symptoms of stroke, don't wait because it might be too late. Dial 911. Time lost is brain lost.
G-Morning, sunshine. Wakey, wakey. Text me.
I think it might be one of the monitors.
Are your parents home later? We can hang. LUV, love you. JK. Holla back. Holla back. Holla back. Are you with your friends? That's lame. We're in a huge fight right now. XO. What'd you dream about? Something I did. Are you on your way to the mall? I'm lonely. Nude pics. Send me some. Text me.
I'm starving. What's for breakfast?
Guten Tag!
Johannes, Franz!
I bring you arts-enriched Raisinblums, fortified with increased test scores and creative problem-solving skills.
It's good!
And good for you.
Bobby? Susie?
Don't worry, that's just the power of the arts!
Feed your kids the arts. For 10 simple ways to learn how, visit AmericansForTheArts.org.